So in this video we are going to discuss about the other one, that is the one that's remaining, that is ergometrine, right? So by this time I don't have to tell you how important this question is for your exam and your clinical life. Like it's something that you should really understand. It has come multiple times in your exams. So we discussed about oxytocin, we discussed prostaglandin. So in this video we are going to discuss about ergometrine, right? So what is ergometrine? So ergometrine is a natural alkaloid, right? So what is ergometrine? Ergometrine is a natural alkaloid. Now more important than what is ergometrine, what's more important is what kind of contraction does it causes, right? So by this time, if you watched my first two videos on oxytocin and prostaglandin, in those videos I've talked in detail about the types of contraction. There are basically two types of contraction. One is tonic type of contraction, in which the contraction is not followed by relaxation, it is like persistent contraction, and the other one is a clonic type of contraction, right? In clonic type of contraction, the contraction is followed by relaxation, right? So ergometrine causes tonic type of contraction, that is when it contracts the uterus, so this is your uterus, when it contracts the uterus, it does not relax, so it causes severe persistent contraction of the uterus, alright, constant contraction of the uterus, and the contraction of the whole fundus, body and cervix at the same time. So it contracts the fundus, it contracts the body, and it contracts the cervix as well. So it contracts the whole of the uterus as a single unit, right? This type of contraction is known as tonic type of contraction. So ergometrine is a natural alkaloid and it causes tonic type of contraction, right? So what is the use of ergometrine? I mean, if it's a drug, right? So if it doesn't have a use, why are we even studying about it, right? So what is the use of ergometrine? The most important use of ergometrine is to stop postpartum hemorrhage, right? So in the prostaglandin video I've discussed about postpartum hemorrhage. So in this video too I'm going to go about it very quickly. So basically what postpartum hemorrhage is, see, this is your uterus, alright? This is a pregnant uterus, there's a baby inside here. So this is your baby, right? Or let us draw the baby in blue, right? So this is your baby, right? And this is the uterus. So whenever there is delivery, normal vaginal delivery, what happens? The baby comes out, and after the baby comes out, so this is your baby, right? And the baby is then connected to the uterus via this structure called the placenta, and this is your umbilical cord, right? So after the baby has come out of the after the baby has been expelled from the uterus, then after around 15 to 30 minutes, right, this placenta also comes out, right? So at first the baby comes out, then the placenta comes out. But since this placenta, see, this is the placenta, for example, and this placenta is very since this placenta, wait a second, so this placenta is really embedded within the wall of the uterus, right? So this is your placenta, right? And it has its roots within the wall of the uterus. The placenta is really deeply enrooted inside the wall of the uterus, right? So when this placenta comes out after the delivery of the baby, there is going to be massive amount of blood loss from the site where the placenta was embedded, right? Because now the placenta came out, so all these blood vessels in the uterine wall, they are leaking now, right? This is known as blood loss, right? Blood loss is also known as hemorrhage. So the hemorrhage that happens after the expulsion of placenta, right, after delivery means partum, right? So postpartum hemorrhage, right? Postpartum means after delivery, hemorrhage means blood loss. So the blood loss that happens after the delivery of the baby and the placenta is known as postpartum hemorrhage, and it is very much important because it is one of the most important causes of maternal death within developing countries, right? So this is a picture that I got here to explain, like, see how much blood is being lost, right? So after the baby has gone out, right, the baby has been expelled, so how much blood is being expelled, and is being expelled, right? And then all this hemorrhage, all this blood is being accumulated, and if you don't stop this hemorrhage, postpartum hemorrhage, what if this amount of blood is like if it becomes like 2 liters or more than 2 liters of blood loss, then the mother will go into shock, right? And believe it or not, a lot of women die because of excessive postpartum hemorrhage, excessive bleeding after delivery, right? So if we want to stop this bleeding, what we can give is we can give ergometrine. So what ergometrine does is, we already know it causes tonic type of contraction, right? So it causes tonic type of contraction. It really contracts the uterus. It causes tonic type of contraction. So when the uterine wall is tonically contracted, when the wall is really contracted, right, extremely contracted, what happens is, we know that the reason for postpartum hemorrhage is these blood vessels in the uterine wall. Since there used to be the placenta here, now the placenta has been expelled, right? So since the placenta has been expelled, the blood vessels in the uterine wall, this is your uterine wall, they are leaking, this is causing the hemorrhage, right? So if you want to prevent or stop this hemorrhage, what we can do is, when the uterus contracts, when there is severe contraction of uterus, what is contracting? The uterine muscles are contracting, and these blood vessels are within the uterine myometrium, right? Myometrium of the uterus, right? So when the uterus contracts severely, vigorously, that is a tonic type of contraction, that is it's contracted and it remains contracted. This myometrium also contracts, right? So the myometrium also contracts. When the myometrium is contracted, what will happen to the blood vessels within the myometrium? See, so this was your blood vessels previously that was leaking, right? All this blood was leaking. Now when the myometrium got contracted, the blood vessels also got squeezed, right? So the blood vessels are now, if a blood vessel is squeezed, then can it bleed? Will there be any bleeding? No, right? So when there is tonic type of contraction, the uterine myometrium contracts. Due to contraction of the uterine myometrium, the bleeding blood vessels get compressed, and this when the blood vessels are compressed, there is no more bleeding. So if there is no more bleeding, we have stopped postpartum hemorrhage, right? So we have stopped postpartum hemorrhage and hopefully saved the life of the mother, because if the hemorrhage continued, then the mother would probably die because of blood loss. So I hope that makes sense how giving ergometrine will cause tonic type of contraction and how tonic type of contraction leads to stopping of postpartum hemorrhage, right? Now, so postpartum, another use of ergometrine is to increase the involution of uterus after delivery in multiparous women, right? So what is involution of uterus, right? Basically what happens is, during pregnancy, like in a normal woman, the uterus is this small, right? So in the normal woman, the uterus is this small, right? But as the woman is pregnant, the uterus, as the baby grows within the abdomen, the uterus becomes very enlarged, right? I don't know how many times, but I don't, more than 10-20 times, I guess. It becomes very big. So you can see the tummy, right? It becomes very big. So after the delivery, so there was the baby here after the delivery, right? So after the delivery, the uterus doesn't need to be this big, right? It has to come back to this original place, right? After the delivery, the uterus has to come back to its original size, that is a small size, right? This process is known as involution of the uterus after delivery, the process by which it comes back to its original size, right? So but in this normally happens in a normal woman, this happens, right? So you see, gives birth, and after a while the uterus slowly starts shrinking and it comes back to its normal position, right, or more normal size, right? But in a multiparous woman means the woman has given birth to multiple babies, right? Has given birth multiple times, right? Like I don't know, 5 or more times, right? 5, 6, 7 times. If a woman has given birth 5, 6, 7 times, what will happen to the condition of the uterine wall? If the woman who has given birth 7 times, her uterus has been stretched and relaxed 7 times, right? So if you stretch a balloon or stretch a rubber band multiple times, what will happen? After a while, the rubber band is going to get loose, right? So similar thing happens in a multiparous woman who has given birth multiple times, 5, 6, 7 times. The uterus becomes so stretched, right? Because it has been stretched and relaxed so many times, it becomes so loose that after the birth, this uterus does not have this elastic capacity to go back, right? So they have problems in. So multiparous women, since the uterus have been stretched for so many times, the uterus does not go back to its original size. So that is, they have problem in involution of the uterus. So in multiparous women, they have a harder time in the process of involution of the uterus, right? The uterus does not go back to their original position because they have been stretched. The uterus has been stretched, right? So in this woman, if we give ergometrine, we already know ergometrine is a type of ecbolic drug, right? Ecbolic drug. Right, so it's a type of ecbolic drug. So what do ecbolic drugs do? They contract the uterus. So when we give ergometrine, it will cause contraction. It will cause contraction of this uterus. So when this uterus is being contracted, what will happen? It will cause contraction of this uterus. So when the uterus is contracted, what will happen? It will expanded uterus. When you give ergometrine, it causes contraction of the uterus. So when the uterus is contracted, it becomes smaller in size. So smaller in size, it kind of helps in the involution process. So in those multiparous women who have difficulty in involution, we give ergometrine, causes contraction of the uterus to help in the involution process or to make the uterus smaller, right? So that is another use of ergometrine. It is also used in involution of uterus after delivery in multiparous women. That's why we use it in multiparous women, because like a woman who has given birth only 1 or 2 times, her uterus can go back to its original position more or less by itself because it has the elasticity, right? Now one more thing that I have mentioned, let me clear this out. So one more thing that I have mentioned is, right, so it causes tonic type of contraction, that, right, we should only give this after the expulsion of placenta, right? This is another very important, right? So I told you to prevent this postpartum hemorrhage, right? To prevent this postpartum hemorrhage, where is it? After the delivery of the baby, we give ergometrine to prevent the bleeding blood vessels by contracting the uterine wall, right? But when, the question is, when should we give it? The question, I mean, obviously after the delivery, but if you give it, say I told you first the baby is delivered, then the placenta is delivered, right? So if you after the baby is delivered, for example, the baby is delivered and you cut the cord, right? You cut the cord. Right after cutting the cord, if you give ergometrine, what will happen? Right after cutting the cord, if you give ergometrine, then it will suddenly start causing tonic uterine contraction. But this is not what we want, because we know if you, after baby is born, we still have to wait for the expulsion of this thing, that is the placenta, right? But we did not wait for the placenta to be expelled. Right after the birth, you cut the cord and you didn't wait. You didn't know that you should wait, right? So you didn't wait for the placenta to be expelled, and you gave ergometrine. What will happen is the uterine will undergo tonic contraction, severe contraction, but within the uterus there is still placenta remaining. So the products of conception will be retained within the placenta. This is known as, in gynecological term, we call it retained placenta, right? So do we want this to happen? No, right? Because placenta should ideally be expelled during the delivery process. Yeah. No, I'm making a video, huh? No worries, I can edit it out. Anyway, so where was I? So we should ideally give ergometrine after the delivery of placenta, because if you give it before the delivery placenta, the placenta will still remain within the uterus and the uterus will contract. So this will lead to retained placenta, and this is not a good thing, because if the placenta if there is something within the body that is not supposed to be there, then it is going to cause problem, right? So this placenta should not be within the uterus after the birth of the baby, but we kept it because we gave ergometrine before the expulsion of placenta. So this placenta becomes a site of infection, right? Because this placenta is like no longer needed, right? So this retained bits of placenta within the uterus will become a site of infection, and this can then lead to sepsis, right? Infection, sepsis. And if you don't treat it in time, so from infection it can lead to sepsis, and if you don't treat this in time, then it can lead to septic shock, and again death of the mother, right? So see how important this thing is, right? So you should always remember that you should only give ergometrine after the delivery of placenta, right? So that you don't accidentally keep the bits of placenta, right? So after you have to wait until the baby is delivered, then you have to wait for 15 to 20 minutes, and then the placenta will be delivered, then only you give ergometrine to prevent this retained placenta problem, right? So I hope that makes sense. Why do we give it after the expulsion of placenta? That is also important to understand, right? So we discussed about the uses, right? And we discussed about tonic contraction, and we discussed why or when should we give it, right? Now another side effect or the thing that you should consider is do not use it during labor, right? Causes prolongation of labor, right? So another thing is you should not, the only time which I mentioned that you should give ergometrine is after the delivery of the placenta to prevent postpartum hemorrhage, right? So if you give during the delivery process itself, what will happen? See, this is your uterus, right? And this is your baby, right? So during delivery, what will happen? The uterus needs to contract and relax to slowly push this baby outside. So this part is like pushing something outside, right? So this part should contract, and this part, cervix, should relax, right? So the fundus and the body of the uterus should contract so that it pushes the baby downwards, and the cervix to relax so that the baby can actually come down, right? This is what happens in a labor process, right? But if you give ergometrine during the labor process, if you accidentally give, right, if you give ergometrine during the labor process itself, what will happen? Ergometrine will cause what type of contraction? A tonic type of contraction. And in tonic type of contraction, we studied that the contraction happens of the whole uterus. So this part will also contract, and instead of relaxing the cervix will also contract, right? Because in tonic type of contraction, everything contracts, right? The body, fundus, and the cervix. So if the cervix is also contracted, right, will the fetus get any space to go out, right? Yes, the fundus and the body are pushing, but the cervix is not relaxed, it's also contract because we gave ergometrine, right? So will the fetus go out? No, because it does not have any space to go out because we also contracted the cervix by giving ergometrine. So this will lead to a couple of very bad things. One is prolonged labor, prolonged or obstructed labor. We have obstructed, so the labor process does not proceed forward, the baby can't go out, so it prolongs the labor process, and it can also lead to fetal asphyxia. So it leads to fetal asphyxia, that is the fetus does not get that is the fetus does not get enough blood, oxygen. Why doesn't it get enough oxygen? Because when you contract the uterus, what did I tell you before? When you give ergometrine, it causes tonic contraction. So due to contraction of the uterine myometrium, all the blood vessels going to the placenta, they get squeezed, right, vasoconstricted, right. So that is good when the baby has gone out and the placenta has gone out. But if you cause vasoconstriction of the placental blood vessels, right, vessels going to the placenta, when the baby is still inside the uterus, right, so when the baby is still within the uterus during delivery process, the baby still needs the blood and the oxygen from the placenta, right. But if you do tonic contraction by giving ergometrine, what will happen is all the blood vessels will be vasoconstricted, right, which due to the mechanism I explained earlier. So due to this vasoconstriction, all the blood vessels going to the placenta will be vasoconstricted, so the placenta will not get any blood, right, because the vessels are constricted. So when the placenta doesn't get any blood, what will happen? Will the fetus get any blood? No, right, because all the blood is coming from the placenta. So the fetus will get no blood. No blood means no oxygen. So it can lead to fetal asphyxia. The fetus can't breathe because you constricted all the blood vessels going to the fetus, right? And it can lead to death of the fetus. So the fetus can actually die if you don't know. So it's a very important thing to understand. Do not give ergometrine or any drug that causes tonic contraction during the labor process. You only give it after the labor, after the delivery, right? And in some cases, if see this thing is also contracted and the whole of uterus is also contracted, right? So the fundus in the body are also pushing it, but the cervix is also contracted. There is a build up of pressure, right? In extreme cases, it can cause rupture of the entire uterus because you are contracting, but the baby has nowhere to go. So the pressure builds up and it can cause sudden rupture of the uterus. So it can even lead to rupture of the uterus, and this is very bad. It will kill both the mother and the fetus at the same time, right, which we do not want. So imagine how important this is to understand. When should you give ergometrine? You only give it after the expulsion of placenta, right? So that is something that you should be very careful of while giving ergometrine, right, if you are a gynecologist, right? So anyway, so that is all about ergometrine. So ergometrine, as I mentioned, it is ergot alkaloid. It is derived from a fungus, right? So it is a natural alkaloid. So that is it for ergometrine. Ergometrine is a natural alkaloid. It causes tonic type of contraction, and we discussed where is it used, how does it work, and some important considerations, some important times in which we should not give ergometrine. That is what I want you to understand from this video, right? So I hope that was helpful. And if you want these notes, I have notes on pretty much everything. You can go and get these notes from my website, the link of which is in the comment section of this video. So I hope this video was helpful. So that's it for today. Thanks.